Good night. My name is Nicola Frazier. I just want to follow up on my previous presentation. I want to discuss the evidence-based model that was used to address Caitlin's situation. The evidence-based practice model that was used to develop the care plan for Caitlin was the Iowa model. First, I assembled a team that would include the RN, nurse manager, the physician, Caitlin's pediatrician, the respiratory therapist, the pharmacist, and the hospital's policymakers to evaluate the issue to provide safe, quality care for Caitlin. Secondly, I gathered all the data and evidence to include the best clinical guidelines and practices. All the evidence was centered around Caitlin and her parents. They were scientifically and critically appraised by the team. Also, the recommendations were made available to all the team members. A shared decision was made among the team whether the findings supported a practice change in addressing Caitlin's diagnosis of cystic fibrosis. The team then decided that the use of telehealth and telemedicine was the best available and appropriate evidence that supported the practice change. The guidelines were written and tested on Caitlin. The desired outcome to be achieved was based on data collected regarding Caitlin's plan of care. The process was then evaluated. In evaluating the positive benefits to Caitlin's outcome, the application of the evidence was put into practice, focusing on the context of Caitlin's situation and individualized to meet her needs. To further evaluate the implementation of the model, there were no further readmissions or visits to the emergency room. Caitlin received care in a timely manner. Her chest physiotherapy was performed safe and effective by her mother with assistance from the respiratory therapist via Skype.